Today we're going to be talking about tampons. Tampons come in many different shapes and sizes. Some may have plastic applicators, some may have cardboard applicators, and some may have no applicator at all. And what works best for you is going to be fully based on your own personal preference. In addition to applicator type, tampons come in many different absorbencies. So you have regular tampons, you'll have super tampons, you might have ultra tampons, you might have light tampons, and all of that is just based on how much menstrual fluid the individual tampon can hold. So for example, a regular tampon can hold less menstrual fluid than a super tampon can, and etc. So that will all depend upon your personal preference and your menstrual flow. So on your lighter days, you might want to use a regular tampon, whereas on your heavier flow days, you might want to use a super tampon. And absorbency has nothing to do with the amount of time that you can leave a tampon in. All tampons need to be changed usually every 4 to 8 hours, and that might look a little bit different based upon your own menstrual flow. So on your lighter days, you might be able to leave your tampons in a little bit longer between changing them, whereas on your heavier flow days, you might be changing every 4 hours or even maybe more frequently than that. And the important thing with tampons is that you should not leave them in for more than 8 hours, or you run the risk of a severe bacterial infection called toxic shock syndrome. So now we're going to go on to the fun stuff, which is how to insert a tampon. So as you can see here, I have both a regular and a super. You can usually tell them apart because the different absorbencies typically are in different colored packaging, or there will be a letter on them. So there's an R here or an S here, which will help you denote what absorbency it is that you're using. So once you are ready with your tampon, you're going to open the packaging at the applicator end, so the side with the string, and then you're going to want to get into a comfortable position. And this will look a little bit different for everybody. It's just all based on your personal preference. For some, you may just be seated on the toilet. For others, they may like to have one leg kind of propped up on the seat of the toilet, and for others, they might like to just be, laying down. It's really all personal preference. And once you've gotten into your comfortable position and you've gotten relaxed, you're going to pull out your tampon. And there's usually like a grip here, which is where you want to hold it. And when you're ready to insert it, you're going to angle it towards your lower back and tip to grip. So you're going to want to insert it until where your grip is, where your fingers are touching your external genital area. Once you've gotten to this point, you're going to depress the plunger. And some people can do this with one hand. Some people you might have to use, 2 hands to kind of get that plunger depressed. So you're going to push it all the way in, and then you will pull out just the applicator, which will leave the string behind, and you will be good to go. When your tampon is properly inserted, you shouldn't be able to feel it. And if it feels wrong or doesn't feel quite right, then you should remove your tampon and reinsert a new one to make sure that you've gotten it in the correct position. And then you can go about your day. When you're ready to remove your tampon or change your tampon, you'll just grab the string and pull it out. And then you'll want to dispose of your tampon in the garbage and wash your hands, and you'll be good to go. And that's how you insert a tampon.